Now, with the Malaysian population fast approaching an all-age society and the country rapidly becoming an aging nation, Malaysians must prepare for a better future in their later years. Regarding this, the Dean of Health and Wellbeing Research Cluster, Institute of Research Management and Monitoring of Universiti Malaya, Prof. Dr. Noran Naqiah Hairi highlighted three key aspects that must be prioritised, namely health, wealth and self.
Basically, we need to take control of our health because they say health is wealth, and we've seen this with the COVID-19 pandemic, right? So we really need to take to own our age. So that's what it means by health. And what do you mean by wealth? So basically, what I mean is that we need to save sooner, so we do not outlive our wealth. So meaning that we have enough resources or enough financial support or even the social security for us to live within that period of time. And of course, the other component is self. So how do we see ourselves in the future, right? How do we want to see ourselves? What kind of person do we want to be? So these three important components, the health, the wealth, and the self, is very, very important.
Elaborating further, she said these components are closely tied to each other. This can be seen when the COVID-19 pandemic hit the country, as it had a negative impact on the community, especially the older generations. Speaking on the topic of healthcare, Malaysia's aging nation, on the Nation programme on Wednesday, she said the pandemic, together with other illnesses caused by non-communicable diseases, leads to a higher cost of medical expenses as well as healthcare providers and facilities. Noran also shared a 2018 Health Ministry survey finding, which revealed that 30% of the population aged 60 and up had diabetes, 50% had high blood pressure, and 40% had hyperlipidemia or high cholesterol levels. The same study also found that a percentage of the older population is overweight or obese and malnourished. In response, more efforts should be made to raise awareness about issues affecting the elderly, such as health and social security support.
And of course, there's also issues about sufficient social protection, right? So older people generally depends on income from their work or from the saving, as well as some also depends on the financial support of children. And care for the older people, the services are also needed if their health is not at the utmost well level. So meeting the challenges of older people is actually everyone's business. It starts from the individual and then of course the government and policymakers as well as the healthcare providers.